Hi guys, welcome to channel Dimensions of Anatomy. Myself, Dr. Aravinth. We will be discussing the functional components of cranial nerves in this video. Functional components is often a confusing topic which the students find difficult to comprehend and mostly end up mugging it. In this video, I will try to explain the functional components in a clear, lucid manner, easily comprehensible for the students, so that they can answer any question on functional components without much mugging up. Okay, let's dive into the topic. Before moving on to the functional components, let's recollect the list of cranial nerves. There are 12 cranial nerves, starting from the olfactory, which is concerned with sense of smell, optic, concerned with the sense of vision, the oculomotor trochlea, the third and fourth nerves, along with abduction, the sixth nerve, concerned with motor supply to the extraocular muscles, which are concerned with movement of eyeballs. The fifth nerve, trigeminal, concerned mostly with sensations from face. The seventh nerve, facial, concerned with motor supply to the muscles of face. The eighth nerve, vestibulocochlear, concerned with hearing and balance. The ninth nerve, glossopharyngeal, concerned with sensations from posterior one-third of the tongue and pharynx. The 10th nerve, vagus, mainly concerned with supply to the internal viscera and also motor supply to the muscles of palate, pharynx and larynx. The 11th nerve, accessory, which has a cranial part and spinal part. The cranial part joins the vagus in supplying the muscles of palate, pharynx and larynx, whereas the spinal part is concerned with supplying two muscles, sternocleidomastoid and trapezius. The last one, the 12th nerve, is hypoglossal nerve, which is concerned with motor supply to the muscles of tongue. So we have 12 cranial nerves: olfactory, optic, oculomotor, trochlea, trigeminal, abduction, facial, vestibulocochlear, glossopharyngeal, vagus, accessory and hypoglossal. Okay, moving on to the functional components. In order to understand the functional components, we must first know the development of functional components. The central nervous system develops from neural tube, which forms in the ectoderm overlying the notochord. The neural tube is a lumen which forms the central canal of the spinal cord and ventricles. The wall of the neural tube during development is divided into three concentric layers: the inner ependymal layer, the middle mandible layer, and the outer marginal layer. The inner ependymal layer forms the ependymal lining of the ventricles. The middle mantle layer gives rise to the gray matter, and the outer marginal layer gives rise to the white matter. The mantle layer, which gives rise to the gray matter, is further subdivided into a dorsal alar lamina, which is sensory in function and hence called afferent. Afferent means incoming channel, that is sensory, and a ventral basal lamina, which is motor in function and is called efferent. So the wall of the neural tube is divided into three concentric layers, that is the inner ependymal, middle mantle and outer marginal layer. Of these, the middle mantle layer is further subdivided into dorsal alar sensory or afferent lamina and ventral basal motor or efferent lamina. At the level of spinal cord, the afferent and efferent lamina we already saw. are further subdivided into two columns each, somatic and visceral. Somatic supplies the derivatives of somites and the visceral supplies the inner viscera and glands, which are derived mostly from the primitive gut. So at the level of spinal cord, there are four functional columns: general somatic afferent, general visceral afferent, general somatic efferent, general visceral efferent. Remember, the visceral columns are grouped together at the center. So the order is from dorsal to ventral: general somatic afferent, general visceral afferent, general visceral efferent, general somatic efferent. So dorsal alar afferent lamina is divided into two functional columns: general somatic afferent and general visceral afferent. Same way, the ventral basal efferent lamina is again divided into two functional columns: general somatic efferent and general visceral efferent. Moving up the level of brainstem, the neural tube widens to form the fourth ventricle, and the alar lamina splays open like a book, so that the functional columns, which are arranged in a dorsoventral direction in spinal cord, at the level of brainstem comes to be arranged in a mediolateral direction. And also at the level of brainstem, apart from the existing four functional columns, three more new functional columns are added. Those are two spatial visceral or branchial afferent and efferent columns, which are concerned with supplying the derivatives of pharyngeal arches, and one spatial somatic afferent concerned with supplying the spatial senses. So at the level of brainstem, the number of functional columns become 7, apart from the existing 4, that is general somatic afferent, general visceral afferent, general somatic efferent, and general visceral efferent. 3 new functional columns are added: spatial visceral afferent, spatial visceral efferent, and spatial somatic afferent. The spatial visceral efferent develops medial to general visceral efferent, and the spatial visceral afferent develops lateral to general visceral afferent. The spatial somatic afferent develops lateral most, that is lateral to general somatic afferent. Remember, the general visceral afferent and efferent columns are grouped together at the center, flanked on either side by spatial visceral afferent and spatial visceral efferent columns. These columns in turn flanked by general somatic afferent and general somatic efferent columns. The lateral most is the spatial somatic afferent column. So at the level of brainstem, totally 7 columns from lateral to medial: spatial somatic afferent, general somatic afferent, spatial visceral afferent, general visceral afferent, general visceral efferent, spatial visceral efferent, general somatic efferent. So at the level of brainstem, the dorsal alar afferent lamina divides into 4 columns: spatial somatic afferent, general somatic afferent, spatial visceral afferent, general visceral afferent. And the ventral basal efferent lamina divides into 3 columns: general visceral efferent, spatial visceral efferent, general somatic efferent. Now that we have seen the development of functional columns, let's find an easier way to remember the names of those functional columns. I usually consider the functional components to be having a 3-name formula: the first name, middle name, and last name. The first name has 2 options. It can be either general or spatial. The middle name again has 2 options: somatic or visceral. And the last name can be one of the two, that is afferent or efferent. The name of functional columns is a combination of these, totally 8 combinations of possible, but as we saw, there is no spatial somatic efferent, so that makes total 7 combinations. The first name can be general or spatial, the middle name somatic or visceral, and the last name afferent or efferent. So that gives general somatic afferent, general somatic efferent, general visceral afferent, general visceral efferent, spatial somatic afferent. As I told you, there is no spatial somatic efferent, spatial visceral afferent, spatial visceral efferent. Totally 7 functional columns. Now that we are okay with their names, let's see what these functional components are. The functional components, as we saw, are subdivisions of gray matter with a particular set of functions. These functional columns in turn subdivide into specific nuclei of the cranial nerves. Nuclei refers to a group or a bunch of neuronal cell bodies, that is cell bodies of neurons, the axons of which bunch together to form a nerve. So functional columns are subdivisions of gray matter with a particular set of function which subdivides into specific nuclei which gives rise to the nerve. Now let's see each functional column, the set of functions it is concerned with, and the associated nuclei. The general somatic afferent is the column concerned with general senses, that is pain, touch, temperature, which are grouped together as exteroceptive senses, and feedback of muscle contraction and joint position, which is called proprioceptive sense. So our general somatic afferent is concerned with pain, touch, temperature, and also proprioceptive sensations from somatic derivatives. The nuclei associated is the trigeminal nuclei, that is the main sensory nucleus, the spinal nucleus, and mesencephalic nucleus of trigeminal nerve. The general somatic efferent column is concerned with the motor supply to skeletal muscles of somatic origin. The nuclei associated are oculomotor, trochlear, and abducens nucleus supplying the extraocular muscles, and hypoglossal nucleus supplying the muscles of tongue. Coming to the general visceral afferent column, it is concerned with the general sensations from the internal viscera. The nucleus associated is nucleus tractus solitarius, which is associated with 9th and 10th nerve. The general visceral efferent column is concerned with motor supply to smooth muscles of the viscera and secretomotor supply to glands, which is provided after relaying through peripheral autonomic ganglions. The associated nuclei are Edinger-Westphal nucleus associated with third nerve, which relays in ciliary ganglion and supplies the smooth muscles sphincter pupillae and ciliaris. The lacrimatory nucleus, which is associated with seventh, that is facial nerve, relaying in pterygopalatine ganglion, supplying the lacrimal gland. Superior salivatory nucleus associated with seventh nerve again, relaying in submandibular ganglion, supplying submandibular and sublingual salivary glands. The inferior salivatory nucleus associated with ninth, that is glossopharyngeal nerve, relaying in otic ganglion, supplying the parotid salivary gland. The dorsal nucleus of vagus associated with the vagus nerve, relaying in ganglia present in walls of internal viscera and supplying the abdominal viscera. The spatial somatic afferent column is concerned with spatial senses from somatic derivatives. The associated nuclei are cochlear for hearing, vestibular for balance, both associated with eighth nerve, that is vestibulocochlear nerve, and optic concerned with vision, associated with optic nerve. As I told you, there is no spatial somatic efferent column. The spatial visceral or branchial afferent column is concerned with spatial sensation from the branchial or pharyngeal arch derivatives. The sensation concerned is the sensation of taste. The associated nucleus is nucleus tractus solitarius, associated with 7th, 9th and 10th nerves. The spatial visceral or branchial efferent column provides motor supply to muscles derived from the pharyngeal arches. The associated nucleus includes the motor nucleus of trigeminal nerve, which supplies the muscles of mastication, the facial nucleus supplying the facial muscles, the nucleus ambiguous through its associated nerve glossopharyngeal supplying the stylopharyngeus, and vagus and cranial accessory supplying palate, pharynx and larynx muscles. Okay, now that we know the associated function, nuclei and nerve of each functional column, I think we are in a position to derive the name of the functional column and associated nucleus from the distribution of the nerve. So if we know the distribution or the structures supplied by the nerve and their embryologic origin, it is easy to derive the functional component and nucleus associated. Let's try doing that exercise. Okay, let's start with the first nerve, the olfactory. We know that it is concerned with the special sense of smell. It is sensory, so afferent. The olfactory epithelium develops from the ectoderm of the frontonasal process. So somatic, spatial sense, spatial, somatic, afferent. But here I must also mention, because the sense of smell is very closely related to the sense of taste, some textbooks consider this as spatial visceral afferent. So either is correct. Moving on to the next, the optic nerve. We know it is concerned with sense of vision. So afferent again, spatial, somatic, afferent. Next, oculomotor nerve. We know it is motor supply to extraocular muscles. So obviously efferent. Extraocular muscles come from somatomeres. So somatic, general, somatic, efferent. It also carries proprioceptive fibers from those muscles. Proprioception we already saw, it is general, somatic, afferent. Accommodation is brought about by smooth muscles. We already saw the smooth muscle motor supply comes from general, visceral, efferent. Associated nucleus is Edinger-Westphal nucleus. Trochlear nerve, again extraocular muscle, so general, somatic, efferent, with proprioception, general, somatic, afferent. Trigeminal nerve provides motor supply to the muscles of mastication. Motor supply, so efferent. Muscles of mastication are derivatives of pharyngeal arches, so spatial visceral or branchial efferent. Associated nucleus is motor nucleus of trigeminal nerve. Proprioception from those muscles, but here remember, proprioception from any muscle, whether it is a somatic derivative or pharyngeal arch derivative, proprioception is always carried by general, somatic, afferent. Nucleus is mesencephalic nucleus. Apart from this, trigeminal nerve provides general sensation to face. General sensation, that is pain, touch, obviously general, somatic, afferent. The nucleus associated is superior sensory nucleus and spinal nucleus of trigeminal nerve. Abducens nerve, again extraocular muscles with proprioception. General, somatic, efferent, general, somatic, afferent. Associated nucleus, abducens nucleus. Coming to facial nerve, it provides motor supply to muscles of facial expression, which are pharyngeal arch derivatives. So, spatial, visceral, efferent. Associated nucleus, motor nucleus of facial nerve. Proprioception, I told you, is always general, somatic, afferent. Facial nerve also supplies the skin around the ear. It is also general, somatic, afferent. But this is projected to the nucleus of fifth nerve. Next comes the taste sensation from anterior two-thirds of the tongue. You must have already guessed, it's a spatial sense from pharyngeal arch derivative, that is tongue. So spatial, visceral, afferent. The nucleus concerned is nucleus tractus solitarius. It also provides secretomotor supply to submandibular and sublingual gland. Secretomotor supply to glands is, as we saw, general, visceral, efferent. The nucleus associated is superior salivatory nucleus. It is secretomotor also to the lacrimal gland, again general, visceral, efferent. The nucleus associated is lacrimatory nucleus. Moving on to vestibulocochlear nerve, concerned with hearing and balance. It's a somatic sense, spatial sense, spatial, somatic, afferent. Nuclei concern vestibular and cochlear nucleus. Coming to the ninth nerve, glossopharyngeal, it provides motor supply to stylopharyngeus muscle, which is a branchial arch derivative. So, spatial, visceral, efferent. Nucleus associated is nucleus ambiguous. Proprioception is always general, somatic, afferent. Along with proprioception, it also carries general sensation from middle ear. Glossopharyngeal nerve is also secretomotor to parotid gland. Secretomotor, as you must have already guessed, is general, visceral, efferent. Associated nucleus is inferior salivatory nucleus. Glossopharyngeal carries taste sensation from posterior one-third of the tongue. Taste sensation is spatial sense from pharyngeal arch derivative. So, spatial, visceral, afferent. Nucleus concerned is nucleus tractus solitarius. Glossopharyngeal nerve is also concerned with general sensations from pharynx, which is a visceral organ. So, general, visceral, afferent. Associated nucleus is again nucleus tractus solitarius. Next nerve is vagus. We will see the cranial part of accessory with vagus because all the fibers of cranial accessory is distributed through branches of vagus nerve. Vagus and cranial accessory provides motor supply to muscles of soft palate, pharynx and larynx. Motor supply, so efferent. These muscles develop from pharyngeal arches. So, spatial, visceral, efferent. The associated nucleus is nucleus ambiguous. Vagus nerve provides secretomotor supply to visceral glands. Obviously, general, visceral, efferent. The nucleus associated is dorsal nucleus of 10. It carries the general sensation from viscera. So, general, visceral, afferent. Nucleus associated is nucleus tractus solitarius. It carries taste sensation from posterior most part of the tongue. Taste sense is always spatial, visceral, afferent. The nucleus associated is nucleus tractus solitarius. It also carries general sensation from skin around the ear. General sensation, so general, somatic, afferent. This is projected to the nucleus of 5. Spinal accessory provides motor supply to sternocleidomastoid and trapezius. Both muscles develop from somatomers. So general, somatic, efferent. The nucleus associated is spinal nucleus of 11. Here again I have to mention, since these muscles are closely related with pharyngeal arches along with cranial accessory part, some textbooks consider spinal accessory also as spatial visceral efferent. So either is right. The final nerve, the hypoglossal nerve, provides motor supply to the muscles of tongue along with proprioception from them. Muscles of tongue develop from somatomeres. So general, somatic, efferent along with proprioception, general, somatic, afferent. Nucleus associated is hypoglossal nucleus. With this, the class ends. Now I believe you are thorough with the functional components of cranial nerve and you will be able to answer any question on functional component without any mugging up. Hope so. If you like my class, do hit the like button. For more such class videos, keep the channel subscribed. The PDF notes, as usual, are available in the link provided in the description. For live online classes and guidance, contact the mail ID provided in the description. Thanks for watching. Bye.